is it? Okay, good. And do you have any allergies? Any allergies? Anything at all? Peanuts, anything? Okay, good. That's my little questions done. Okay, told you it wasn't long, was it? Told you it wasn't long. No. Now, let me get my gloves on before we do anything else. I probably will need to touch you, your face, and your scalp today. Okay, I'll tell you everything as we do it, so there will be no surprises. Everything will be okay. Let me just grab my gloves. Marvelous, they fit like a glove. So good, so marvelous. Now, the first part of any general medical checkup, I think even you may know this, is to do your heartbeat, listen to your heartbeat and to listen to your lungs as well. Okay, let's go. Now, I'm going to do this over your clothes, so there's no need to get naked, okay? No need. Yes. Working fantastically well. Let's go. First things first, your heartbeat. Good. That's a great heartbeat. Absolutely perfect rhythm. Strong. Good BPM. Yes, that's fantastic. That's absolutely fantastic. Now, I'm going to place this on a couple of different locations, and you're going to breathe for me slowly and deeply. You're going to imitate the breaths that I take, if that makes sense. Okay, now then, here we go. Deep breath in for me, please. Hold. And out. Really good. We're going to do that a couple more times, okay? Different locations for the stethoscope. Breathe in for me, please. And out. That's great. One more location. Let me get the perfect position. Here we go. Breathe in for me, please. And breathe out. Absolutely perfect. What wonderful lungs you have. Sounds very nice. No crackliness, no wetness, no thickness. Perfect, clear, healthy lungs. We're off to a good start. Okay, now then, the next thing I want to do, I just want to check your scalp and your hairline, that sort of area, for cuts, abrasions, bruises, swelling, anything like that, okay? So, I'm going to touch you, of course, got my gloves on, so we're nice and clean and hygienic, okay? Here we go. Don't try and nice and gentle now as I look through your scalp, okay? As I look through your scalp. Just looking through your scalp, okay? Just looking through the scalp there. Interesting. That's interesting. That's interesting. Okay. Okay. Bit of a bruise and a little bit of swelling here. Have you bumped your head recently? Have you bumped your head at all? A little bit of a bump on the head, is it? Now, why didn't you tell me that at the start? Come on now. Come on now. You didn't think it was that big a deal. That's understandable, but you know, I need to be careful and I need to check everything when it comes to your health. Okay, very important. Your health is very important. We need to make sure that you're in tip-top condition and that you haven't been negatively impacted by a little bump in the head or anything like that. Okay, now let me just very quickly check your eyes as well. Okay, now then, have you experienced any sort of blurry vision since the bump on your head? No. Good. Have you experienced any sort of dizziness? Good. Have you experienced any sort of headaches at all? No. Good. Good. Okay. Okay. Not bad. Good sign so far. We will of course do some testing. And the first thing I want to do is I want to use this light. As you can see, lovely little light here. I'm going to put my hand over one of your eyes, don't worry. And we're going to bring the light in and out of your vision. Just like this. And I'm going to be making some key observations here. Some absolutely key observations. My apologies for the noise there outside the clinic. A little scooter going past. And some loud people. Probably someone getting some Uber Eats delivered to them. Lazy individuals, absolutely lazy. I've never once used Uber Eats or anything like it. And the last time I got a takeaway was when I was in uni. When I was a lazy, borderline alcoholic uni student. Okay? And I advise you also, as a doctor, to avoid using Uber Eats and to avoid buying takeaway, because that food is the absolute worst you could possibly consume. Totally and utterly devoid of any positive nutrition, drenched in oils, the worst kind as well, with the worst omega ratios you could possibly consume on the planet. Okay, consider being a little bit healthier, making some healthier choices. We all could. Okay, no need to stress over it, no need to stress about it, but you know, maybe try and have a little bit more fruit in your diet. You know what I'm saying? Have a little bit more fruit, something you enjoy. A banana, an apple, some strawberries. Strawberries delicious, aren't they? Maybe have some vegetables as well. A couple more vegetables. Have something you enjoy. Beetroot. Beetroot's quite nice actually. It's quite sweet. Yes, that's good for you. Very good for you. Good for your cardiovascular health. Don't you know? Don't you know? I know because I'm a doctor. Obviously. Right, what was I doing again? Ah yes, I haven't finished with the light. I don't know why I put that away. Stare ahead for me, please. Look at my nose. Ignore the light. Ignore it. Ignore the light. Don't get distracted by the light. Don't get distracted by the light. Only look at my nose. Don't look at the light. Don't look at the light. Look at my nose. Look at my nose. Look at my nose. Don't get distracted by the light. Do not. Do not get distracted by the light. Do not. Where are you looking right now? My nose. Good. Where are you looking now? My nose. Good. What are you looking at? Look at my nose. Good. Don't look at the light. Don't look at the light. Don't look at the light. Okay. Well done. That was a bit of a challenge. For your head. Sorry, maybe I shouldn't pat your head since you had got a little bump there, haven't you? Got a little bump. I shouldn't be patting your head. I won't do that for the rest of the examination. Now then, again, focusing on my nose, please. I'm going to move my fingers in a minute, like this, different directions, and you're going to tell me when you can no longer see them. Okay, so tell me when they leave your field of vision. Here we go. Good. I'm going to take a step back from you now, quite far away, and we're going to do the same thing. Okay, the same thing. Now, focus on my nose. Tell me when they leave your field of vision. Good. Good. Excellent field of vision there. That is good. What am I going to do with you next? Yes, I'm going to use the light again. Now, I want you to follow the light this time. I want you to actually look at the light this time. Look at the light. It's moving, isn't it? It's moving. And so should your eyes. Your eyes should be moving to follow it. Good. Keep your head still for me, please, if you can. And only use your eyes to follow the light as it moves. That's it. That's perfect. What you're doing right there. That is perfect. How do you feel during this? You feel okay? No discomfort? No headache? No dizziness? No. I feel a bit like a wizard right now, actually, for some reason. A bit like a wizard. Waving my wand. Casting a spell on you. It's Leviosa, not Leviosa. You absolute noob. You wouldn't understand. You aren't a wizard like me. I'm a wizard. Right, sorry, what is my next test that I want to do with you? Yes, further investigating your peripheral vision. Keep your eyes on my nose. Now, I'm going to wiggle my fingers like this, or like this, or like this. I need you to tell me which fingers are wiggling, left, right, or both. Okay, focus on my nose. Let's go. Good. I'm going to reposition them every now and then. Good. I'm going to tilt myself slightly. I'm going to hide from you slightly. Good. This is what our appointment would be like if you were a giant and if I was really short. But I'm not, am I? No. I am the giant here and you are the short one. You short little creature. That's okay. Right, you did well there. That was a bit shorter than I expected because I got distracted. Sorry about that. My apologies. My brain is all over the place today, but we are getting through the test just all the same. Perfectly, in my opinion. Now, the next test is the taste test. I have 3 different flavors that I want you to identify. I'm going to shake up the flavors, the bottles of liquid, and then I'm going to put a little droplet on your tongue, okay? And you're going to tell me what it tastes like. very like strong artificial lime, doesn't it? Almost tastes like a cleaning product. Yeah, I don't like that one. I don't like that one at all. Okay, next, that was the taste test. You scored 3 out of 3. Your taste is working well. Excellent job. Good lord, those cars are a bit loud, aren't they? Storming past the clinic today. Absolutely storming past. What if an elderly patient comes out and tries to cross the road? Have they no respect? Have they no courtesy for others? Of course they don't. They're human. 99% of human beings are selfish little creatures, aren't they? Now then, the next test we're doing is known as the smell test. Very similar to the taste test. You can guess, basically. I'm sure you can. 3 different flavors. Not flavors, smells. My apologies, my brain is not working very well today. 3 different smells for you to identify. Let me shake up the flavors, the smells. My brain is really not working, is it? Book me into an old person's home already. Book me in. Righto, if you're ready, we're going to begin sniffing. Okay, snippity snip. Sorry, this cap is absolutely... Okay, there we go. What a smell, what a smell. Are your nostrils prepared? Good. Take a sniff for me, please. What does that smell like? That smells like vanilla. Correct. Very strong smell sometimes, vanilla, isn't it? Very strong smell indeed. I'm just struggling to get this cap on as usual. As bloody usual. Life is a struggle, isn't it? Life is a struggle. Let's try and identify smell number 2, shall we? Okay, smell number 2. Are those nostrils ready? Here we go. Take a sniff of that, please. What does that smell like? Yes, coffee. Coffee. That smells like coffee. Coffee. Indeed. There we go. Oh, that's the way to do the lid. Brute force. If all else fails, use brute force, isn't it? Yes. Now, smell number 3. The final smell. Let's go, shall we, for smell number 3. Can you sniff that for me, please? What does that smell like? Manuka honey. Correct. We even got the specialty, the brand, the type of honey. Wow, I'm impressed. Well done. Your nose, your ability to smell, absolutely fantastic. It's unlike anything I've ever seen before in a patient. Excellent job. Marvellous. Now then, close your eyes for me, please. I'm going to touch your face with my finger, various different places, quite gently, don't worry. I'm not going to poke you. Right, here we go, and I want you to tell me, did I just touch you? Did I just touch you? Yes or no? Yes, okay, good. And what about then? Did I just touch you then? Yes or no? No. Good, okay, we're gonna keep going now. Now you know the rules of the game. Did I touch you? Yes, good. Did I touch you? Yes, good. Okay. Now, you can open your eyes again. That was just to establish whether or not you have the ability to feel in your face your sensation. Is it working? Yes, it is. Good job. Good job. Good job of being able to feel things. Now, I would like to use a tongue depressor, this little lollipop stick looking fellow here, to look into your mouth. Okay, using a light as well. Now, if you could open your mouth for me, please. That's excellent. I'm just going to push down your tongue with the lollipop stick, with the tongue depressor. Okay, and I'm just going to have a little look inside your mouth now. So if you can just stay still for me, please. I know it's a little bit uncomfortable having a stick of wood in your mouth, pushing your tongue down. Not particularly pleasant, is it? No, like a lot of things that doctors do. Doctors are kind of arseholes, actually, if you think about it, aren't they? They're kind of arseholes, sticking things in your mouth, sticking things in your orifices. Your orifices. Have they no respect? They don't even treat you like a human being, do you? Do they? You may as well go to a vet, to a veterinarian. You'd probably get better treatment, more respect from them than these infernal doctors. Am I right, or am I right? I think I'm right. Good mouth. Your mouth is looking good there. No excessive redness. Gums look good. Everything looks very nice there indeed. Now, I do want to look inside your ears as well whilst I'm here, and for that I'm going to use my little otoscope. Okay, so stay right there. Okay, just need to assemble my little otoscope here. Very basic one. Little nib, little nippy nib, and on it goes. And there we go. You can see. Do you want to have a look through there? Look, you can see, can't you? Can you see anything through there? Let's see if we can position it. Look at that. You can see my eyeball. Hello. What a magnificent eyeball. And I think there's a light as well. Or has that stopped working? Yes, of course the light has stopped working. That's what you get for buying cheap, nasty rubbish from Amazon, isn't it? Amazon. You absolute B-words. Okay. I'm going to look inside your ear now, okay? I'm going to look inside your ear. That's it. That's the perfect view for me. Good. Your ear looks good, actually. You clean your ear regularly, don't you? Yes, you've learned. Usually when I see people, their ears are absolutely disgusting. Filthy individuals. So much wax, you wouldn't believe it. You could barely even recognize it as a human ear, but your ears are good. Your ears are good. You've been taking good care of them, cleaning them out regularly. Excellent. Now I do just want to make some little sounds either side of your head. I want you to close your eyes for me, please. And I want you to tell me which side of your head the sound comes from, left or right. Okay, here we go. Was that left or right? Good. What about that, left or right? Good. What about that, left or right? Good. 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 Okay, that's it. That was the end of the test, not the last one. You don't need to do that one. Okay. Let me just quickly double check my notes. Ah, yes. That's it. We've done it. Congratulations. You've reached the end of your doctor's appointment today. You've done everything that I've asked you to do absolutely perfectly. I could not ask for a better patient, actually, which is brilliant. Thank you so much. seem to have impacted you in any way. Okay, no headaches, no problems with your vision, no problems with your hearing, nothing at all. Okay, so I am happy to give you a nice clean bill of health. Do you have any questions for me today? No questions. Brilliant. I like that. Good. Okay, so that's it for now. Thank you for coming, and maybe I'll see you again